give it 1 minute more, get a critical mass in here. I don't like to start right at the moment, but anyway, welcome everyone. And please, if you didn't hear before, type your name and role in the chat and where you're from, if you don't mind. And ask questions at any point in the chat, and we will save them for our Q&A session after the webinar is over. All right, well, we've got a lot of great content for you today and a lot of great speakers. And we're going to start with an overview of the state of Grandfamilies and Kinship Care Report, which probably many of you attended the release of that report in the fall, so just a couple months ago. The network, which is part of Generations United, so the Grandfamilies and Kinship Support Network, which is the first federally funded technical assistance center on behalf of the families, partnered with the National Center on Grandfamilies to create a complementary toolkit. And that's what we're going to spend the bulk of today talking about, is that toolkit, practical tips, and we're going to hear from all these fabulous panelists that you can see, maybe not their picture right now, but you can see that they're here. And we're really looking forward to gaining their expertise. We do a number of things here at the Grandfamilies and Kinship Support Network, including webinars such as these that are always free of charge. We have 2 coming up in February. Check our website. Individual assistance, so any nonprofit, any state or local, territorial, tribal government that wants to improve its supports and services for kinship families, please, no matter how small or big, reach out to us and we will provide you individual assistance. We have technical assistance specialists and a whole cadre of subject matter experts. And then our website, which has a lot of practical tools, original resources, and this very toolkit that we are going to be discussing today. It's linked right from the top of the page currently, but we will give you all those wonderful resources as we talk today. So we have, as you can see, a number of fabulous speakers. We're really blessed to have so many friends and partners. Jamal Clark, who's the Assistant Director here at Generations United, the National Center on Grandfamilies, will kick us off. Victoria Gray, who you worked here for a while, and she's still a Generations United Grand Voice, and she's the Executive Director of Gray Nickel, which is a very important nonprofit in Phoenix. Rainey Jutsi, who is the Executive Director of ISDD in Atlanta, and I'm not going to try to remember what that stands for. She can tell you when she speaks, but it's a very, one of our kinship exemplary programs, and it serves kinship families, particularly those who are raising children with special needs. Emily Peeler, who is a senior attorney at the American Bar Association Center on Children and the Law and a longtime partner on all things kinship and all things education. So thank you, Emily, for joining us. Laura Tabazada, who is also a Generations United Grand Voice, and she is a consultant at the Village for Rhode Island's kinship, fostering adoptive families. And then finally, last but not least, you'll see I just put this in alphabetical order, Angela Tobin, who's the founder and director of Kinship Caregivers Connect. It's going to be one of our newest kinship exemplary programs, and she is in Ohio. So such a pleasure to have you all with us today, and you are going to be hearing more from all of them later. I will turn it now to Jamal to kick us off with an overview of that national, the State of Grandfamilies and Kinship Care Report.
Thank you, Anna. So good afternoon, everyone. Once again, Assistant Director at National Center for Generations United. Generations United mission is to improve the lives of children, youth, and other adults through intergenerational collaboration.
Jamal, sorry to interrupt you, but are other people having trouble with his sound? Yeah, I'm seeing head shakes for those that I can see. Is there anything you can do? You're hard to hear.
Can you hear me now?
Better.
How is that?
Better.
Okay.
Thank you.
All right. You gotta love technology. How's that? Is that a lot better? Okay. All right. Okay. Go back to my drum major days. Now you learned something new about me. I was in the marching band. But no, it's so good to be with you all to just give you a brief overview of our 2024 State of the Grand Families and Kinship Care Report, Pathways to Success, K through 12 Education Support for Kinship and Grand Families, which complements this toolkit that you're going to learn more about in a few. As you can see, you can scan the QR code on the side, on the slide for the full report, and we'll also drop the link in the chat. I led the development of this report, which highlights the role of education, school support in ensuring kinship and grand family success. Slide. Our reports aim to provide an accurate annual snapshot of kinship and grand families, highlight key challenges and opportunities for improving policies and practice. Our past reports have focused on mental health, food and nutrition, housing, and the opioid epidemic, to just name a few. These reports have influenced public policy changes that have led to improved support for kinship and grand families nationwide. Slide. Children thrive in grand families when they receive the right supports. I think we all agree on that. That is why we are in this space today. We recognize permanency, knowing that they have long-term stable home, cultural identity, being raised by relatives who share their background and traditions, belonging, feeling safe, supported, valued within their family. And then also having consistent caregivers, school environments, and emotional security in place. These factors are all essential for a child's emotional, academic, and social development. Next slide. All right. If you did not know, it's always, did you know? Did you know about 2.5 million children live with grandparents or other kin without parents in home? And then you have over 100,000 children in foster care with relatives. Next slide. The report was informed by education experts, caregivers, young people, and national organizations. Our report uncovers three key themes. Grand family caregivers face overwhelming barriers to supporting the education of children in their care. Children in kinship care have better academic outcomes than children raised in foster care with non-kin. And when grand families get access to critical supports, the children's academic outcomes can soar. Tongue twister. Slide. So what we also recognize is kinship caregivers often struggle to access school-related resources due to legal challenges. Many lack formal legal custody or guardianship, preventing them from enrolling children in school, signing educational documents, or even advocating for special education services like IEPs, which are individualized education programs. Imagine a grandmother raising her grandson may not have legal paperwork to check the guardian box on school forms, making it harder for her to communicate with teachers to access school-based supports. Next slide. All right. Most kinship caregivers raise children outside the foster care system. For every one child being raised by kin in foster care, there are 19 children being raised by kin outside the foster care system, usually without access to the same resources or financial support. Next slide. Children being raised by kin outside of foster care are less likely than those raised by kin foster care caregivers to receive school-based services and other supports, which may help them thrive academically. Next slide. We also recognize the academic outcomes. Children living in grand families and kinship families do better academically with children in foster care with non-kin. Children in foster care with kin do better academically and are more likely to receive supports. So right here, we're just comparing the difference that we see with those in foster care and those outside of foster care system. Next slide. I'd like to share the perspective of Dr. Michael Reber, superintendent of the Osborne School District in Phoenix, Arizona. Dr. Reber has dedicated 30 years to supporting kinship families in educational settings. His key message is these kin caregivers offer the love, stability children need. They know the children, their history, and their needs. They should be supported as they raise them. I also want to point out that Dr. Rober, in the report you'll find, he talks more in depth about the work he's done in his district. He talks about how he hired social workers to connect families to essential services and then also providing behavioral health support. Slide. Throughout our report, we also have recommendations. For example, schools should create and implement plans to regularly share information about available services for grandfamilies. Title I schools should engage grandfamilies in decision-making processes about federal and local funding. And schools should be positioned as central hubs for wraparound services. Slide. Of course, you can scan the QR code. Some of you, if you're trying to panic to find your camera phone, your iPhone, don't worry about it. We're going to make sure you have all of this. If you're like me, I got to do it about 10 times to hold the camera still to get the QR code. But this is the opportunity for you to actually download the report. And as we are about to learn a little bit more about the toolkit, I want to leave you with this. Grand family caregivers are the foundation of children's success. With the right tools and support, these families can create lasting positive change. So I'm excited to introduce the next segment of today's session when we'll explore the 5 Actions Toolkit, a resource designed to empower K through 12 school professionals and kinship service providers. I'll turn it back over to you, Anna.
Thank you so much, Jamal. Uh, as you can see, we had a lot of great information to leverage and to use to create a practical toolkit. Those recommendations directly fed into how we developed this toolkit and the 5 actions. And all of each of the 5 actions have embedded tools and resources from around the country. So we really hope that this will be a useful piece if you work in a school, if you work with kinship families, if you are a kinship family. We do a careful job of defining our audiences and making the steps directed to that audience member. So things for school districts, things for principals. You will see once you delve into the toolkit, it's very defined. Now, the need for all of this, for the State of Grand Families report on this topic, for this toolkit, has been around forever. I started at Generations United in the late 90s. We had just done a survey of caregivers around the country, and the 2 biggest issues were education and housing. And in those 25 plus years, not much has changed. Education and housing are still huge issues for these families. And so that is why we have devoted this year's energies in the report and in this follow-up to the issues surrounding K through 12 education. As you can see on this factoid here, on this infographic, on this slide, one of the images is the cover shot, but the other image is a statistic that is admittedly, creative, but it basically divides, it makes an average of the number of children who are being raised by grandparents and other relatives in each public school in the country. And you can see how we did it. But the point is, one school may have 2,000 children being raised by kin, another may have 1, but there are these families all over the country. And you saw the numbers that Jamal shared. So these are issues that impact all of our communities. So with those defined populations, with that mandate in mind of really supporting these families, and with the recommendations of the report, we developed 5 actions. And the 5 actions you can see here. The first revolves around ensuring the school enrollment forms really explicitly include these families and are tailored to them so they see themselves in the full form and they can fill it out clearly and access education for the child. that using that enrollment information, the schools know how to welcome each kinship family with tailored information for them. And we're going to hear all about how some really exemplary practices around that. Using number 3, inclusive language when schools communicate with families so that families don't feel left out. You know, if communications are just directed at parents, many of kinship caregivers do not see themselves in that word, nor do the children. The 4th step revolves around special education and ensuring that these children and their caregivers are included in the process of developing IEP plans and 504 plans and really meeting the needs of these children. And then finally, considering those, like Jamal talked about, wraparound supports, those school-based supports. So it's basically 5 buckets. And like I say, with practical tools from around the country embedded. And around the enrollment piece, it's really important that when the enrollment forms are better, what's the word? Better tailored to these families, better directed at these families, better included at these families, that they reflect these different legal relationships. Because what happens often is a caregiver is confronted with an enrollment form and it just says parent or guardian. Well, many kinship caregivers are not guardians or parents. Some are. Some of our kinship caregivers have adopted the children in their care, and so therefore they are parents. Some have the legal relationship known as guardianship, but that's a very specific legal relationship. Some states don't even have it. They have legal custody. They have conservatorship. So really making sure that those enrollment forms reflect what are the legal relationships in that jurisdiction, so that we're not asking families to identify with terms that don't even exist, and to make clear who they are to the school, so the school can support them and be inclusive of their needs. So you'll see the toolkit gets into all these different legal relationships a little bit, and it links with other resources that you can access to learn more about each of these relationships. And they vary so much state to state. Some families don't have anything, and they don't have any kind of paperwork. McKinney-Vento federal homeless law, and I'm not getting that title correct exactly, but it's definitely McKinney-Vento, can be a way to enroll those children. Depends on where you live. It depends on the circumstances of the family. But there's more information about that act and that way to access in Appendix B of the toolkit. Some states have educational consent laws. A good number of them do, and they are listed in Appendix C. And that allows a caregiver that doesn't have a legal relationship with the child to complete an affidavit and enroll the child in school without that legal relationship. And those states that have those laws with the forms are in Appendix C. Then there's sometimes parents sign over a power of attorney to the caregiver, and that gives the caregiver authority to enroll the child in school. So you can see there's a real array. And as Jamal talked about, if the kinship caregiver, and a good number are, is a foster parent, then the child welfare agency, the foster care agency, has obligations under law to enroll that child, to get transportation for that child, and to make sure that that child gets the special education they might need. So that also there's some information that's linked in the toolkit for those families. So that the action 1, as I said, is enrollment. So make sure that they align with what's the reality in that state, how the caregivers have the authority to enroll the children in school, that they use words that resonate with the caregivers. They don't just say parent or guardian. They explain what they're talking about. They ask for specific enrollment information on the form so that we can identify who are kinship caregivers and who are those children, for the reason of having inclusive language, having tailored outreach, and having more meaningful supports. And you'll see that we ask that the forms have multiple selections, so that an adoptive parent, an adoptive kinship parent, who is just a parent, right, under law, but that they can identify themselves as kinship caregivers as well. And then for the foster parent choice, which often exists on enrollment forms, distinguishing those who are non-related from those who are related, again, for those tailored services and supports. So if amending your enrollment form is not a possibility, and sometimes they're on these massive databases, and there's more work to be done there at the national level in getting some of these, computer companies, for lack of a better phrase, to get their onboard, their online enrollment forms more supportive of kinship caregivers. So if that's not possible where you are, this is something that Virginia did. They have a family engagement network, and they have a nonprofit in Fairfax, Virginia that worked on this. It's linked in the toolkit, and basically it gets at those questions so that caregivers and the children they're raising can be better served. And asking them questions about how they prefer to be communicated with and the like, so that again, the families are more meaningfully engaged in the children's education. Now, there's a bonus tip here because, if there's not a legal relationship, there's not legal paperwork, there are other ways to do it. And many schools do this. And these are options, and it's in the toolkit, so I'm not going to belabor it. But there are ways to show that the caregiver is really legitimately raising that child. They're not just using that school because, oh, it's got a better football team and Bobby plays football. So mom's just going to say that Bobby lives with grandma, but Bobby doesn't really live with grandma. So to get around those kinds of issues, which do exist, these are ways to show that grandma or whomever is really raising that child. Things like they're on the tax return as a dependent, the grandma's collecting public benefits for that child, and the like. So using that information we gathered in Action 1, welcoming each kinship family, devoting a section of the website to the kinship families, sharing resources. And we have a whole load of free resources at the Grandfamilies and Kinship Network, at Generations United, at the ABA Center on Children Law, which you're welcome to link to, disseminate, print, whatever you need to do, but to get it into the hands of families. Also, Virginia, that same group, the Family Engagement Network, created a checklist for the families so that you can consider creating something similar. And we've linked to that here and in the toolkit. And again, you will be getting all these slides. Here is an example of a kinship caregiver service agency reaching out to the school to develop a partnership to educate the school and the people who work at the school about the families, their strengths and their challenges, and how they can better serve them and get information in their hands and connect them with services that the nonprofit provides. And you will see this all spelled out in the toolkit. But here's an example from Rhode Island. And we have Lori here to talk about this and other outreach efforts that they make to connect with the schools. But I wanted to alert you that it is in the toolkit. Action 3, using inclusive language. So just being real careful about not calling things so limited to parents or moms or dads, because there are so many adults raising children now that are foster parents, that are grandparents, that are godparents, that are all kinds of things. And I believe it was Angela who pointed out to me that if you send material home with the child for the parent, the child may look at that and say, well, my parent doesn't live with me. My parent's in jail, so I'm just going to throw this away. They don't even think to give it to the grandma because grandma's not my parent. Grandma's my grandma. So that's where using languages like caregiver or adult or important adult in your child's life is so important. So this is a chart that we recreated, just redesigned, based on work that has been done by the Regional Educational Laboratory in Appalachia for Appalachia. It's a project of the U.S. Department of Education, and they work together as a learning community. Action 4 revolves around special education and really ensuring that children, regardless of who's raising them, if they need special education, they should get special education. A free and appropriate public education is entitled. All children are entitled to that. It's called FAP, free and appropriate public education. At any rate, so making sure that caregivers can request an assessment of the child if they suspect they need services, that they're included in the development of these services, of the IEP plan or of the 504 plan, and really sharing plain language resources. And honestly, that last bit is important for parent-headed families too, really so that families understand what this whole process is. But where we have the wrinkle here is that kinship caregivers don't have automatic legal rights and responsibilities over the children like parents do, so they can face additional hurdles. But know that Generations United worked hard many, many years ago to ensure that the definition of parent in the U.S. Code of Federal Regulations, which is what that stands for, CFR, explicitly includes grandparents, other relatives who raise children when parents can't. You will see this is very inclusive. It doesn't mean that the parent's rights are infringed. If a parent is there and wants to make these decisions, then it's the parent is the parent. But if not, then the kinship caregiver is acting as the parent and has the right for all those things that we discussed, really being part of the process. And then finally, school-based supports. And you will see this all linked in the toolkit as well, including links to family resource centers, an example from Kentucky, where they have family resource centers embedded in schools, really to serve the families where they most go. And that's why this is so critical, because this is where we find the caregivers, at the schools and at the pediatrician's offices, because that's where they got to go. So you'll see all these different examples and learn more in the toolkit. I want to get to our experts, but please stay connected with us, access our monthly newsletter, sign up for it. We will automatically sign you up for it unless you tell us not to, based on your registration for today's webinar. But please share that link with your friends and family. And please follow us on LinkedIn. We do a lot of posts. We did one today on a story out of West Virginia. So it really is a way to stay involved in all things kinship. So I will pause there and welcome my panelists for this first panel to talk about reaching out and using that inclusive language and supports. And I'm privileged today to be joined by Angela Tobin and Lori Tapazada, who I think I introduced you all to earlier, very briefly. And they're welcome to tell you more about themselves because they're both fascinating women. And I admire all they do. They not only have lived experience with the issues, but they devote their lives to the issues. So, Laura, I want to start with you. And we shared your outreach letter in the toolkit. That was Appendix A. And would you talk a little bit about how you in Rhode Island do outreach to schools and let them know about you?
Yes, I would love to. I am a grandmother raising my two grandchildren, ages 8 and 10, and I work with a small nonprofit. And we were originally brainstorming some time back, like outreach to kinship caregivers is notoriously difficult to do. And we're like, where are we going to find them? Schools. So, in all our genius, we came up with this plan that we were going to reach out to the superintendents because there was too many individual schools to even, contemplate. We were just overwhelmed. So we decided to send the outreach letter that is in the appendix and then follow up by phone with the intent was we wanted a meeting because we wanted to talk to them about kinship caregivers because the level of awareness I find is so variable, from school to school to school. Like some people don't know what you're talking about, don't really care. Others are like, oh, thank God, we have all these kinship families and whatever. But so the goal was to get a meeting. And when we did our first round, we have 39 school districts in Rhode Island, which is the size of a postage stamp. So I don't know why we have that many. But of those 39, we only received, I think, 9 responses, if I remember right. And then we went through the process of trying to engage them. We educated them. We also have a training for school personnel around kinship caregivers. And then we delivered to them like a big package of resources, meaning like it's a village packet, but it has all kinds of stuff in it and things that they can hand directly to their kinship families. What we found or find is that it's a good idea to keep maintaining a relationship with the schools, even if they're not engaging with you. But for example, when this original report came out, that's a great opportunity to share. Now the toolkit is another great opportunity to share, or whatever. You just keep that dialogue going because schools have a lot of conflicting priorities, and they're definitely like, oh, yeah, I can see that. Okay. Well, back to my real fire, so it can kind of just fall down. So keeping that relationship going is very important in eventually getting engagement. The other thing we figured out is make friends with the secretary
Mm.
because the superintendent sometimes just doesn't even have the time to really dive into the whole thing. Sometimes they just delegate it to somebody else, which I actually like because usually it's somebody within the social work team or whatever. But the secretary is your best friend. So develop a relationship with the secretary and you'll eventually gain better access. What I've noticed, and not sure exactly how good of a tip this is, but I've noticed when you're talking to people about things intellectually, they get it, whatever. But you have to get to the point where they're like committed and excited to work on this issue. And you can tell when it happens, you can tell. It's like, okay, now they're in, now they're going to drive themselves. Because when you're the ones trying to drive it and they're not 100% committed, it doesn't get that far. And to get to that level, it is all about building relationships. And even though I'm a big fan of Zoom meetings, especially because I live over the border now in Connecticut, um, in person is where it's at. In person, like they definitely kind of catch the fire from being in person. We also partner with another nonprofit called Heart Tree, and they are the sister organization to the Village, but in Spanish. So we work with them, kind of in tandem or parallel so that they can speak to the districts that are, primarily Spanish speaking and things like that. And we do all our resources in English and Spanish as well, to make sure that, we're trying to be as inclusive as possible. Um, and then I already said all that. Oh, but there's one thing I wanted to tell you. So there's a new development, and it's across the border in Canada, and it's a different approach. It's the school my kids go to. And I have been working on it and working on it. And I finally yesterday I got response from the superintendent because I've been working at the principal, and he wants to look at this whole thing, starting with looking at the enrollment form and look at it from a whole district wide, thing. So another approach is to be a pesky, persistent parent within that school system, because I mean, my grandson, he has ADHD, so he can be found at the principal's office from time to time. But every time I had to go in, I also use that as an opportunity to talk about it. Because, where I live in Putnam, Connecticut, he's in a Cub Scout troop that has 12 families. You won't believe how many do you think are headed by grandparents? 8.
Wow.
We have a lot of kinship caregivers in this area of the world. So I'm happy because I finally feel that point of commitment and passion has been reached. And so they're going to try to drive it themselves. Yeah, that's about it.
That's so great, Lori. And the school secretaries you mentioned, what about the school counselors? Is that another one that's been
Yeah, they
helping?
are good. When they include the counselors in the team that we meet with, they are very good. And the social workers, yes, they're interested because they're the ones, working with the kids and working with the issues with the kids. And they
Yeah.
probably know more about who's a kinship family than not, because most schools just can't tell you. How
Yeah.
many kinship families do you have? Well, I don't know. A lot. That's what I hear. But
Well, thank you, Lori. And I see great comments and questions in the chat. And I just want to remind everyone that we're going to have a separate Q&A from 3 to 3:30 Eastern, and you'll get that link. So save your questions too. I mean, keep them coming here because we will monitor them, but thank you for asking them. Angela, I know that you have been training schools on kinship families and their strengths and their challenges and their needs. So what does that training look like? And do you have any tips to share?
Absolutely.
It's great to be here with everyone. Lori, I'm actually from Connecticut, so we have that connection. Yeah, kinship care is everywhere. That's what I've learned from all the different places that I've
Yes.
lived. But my background actually is in occupational therapy. So I come with like a little bit of a holistic health background, but really got into kinship care because of my own family experiences with my grandparents and my parents stepping in as kinship caregivers for my cousin. So I'm very lucky to be able to work with kinship caregivers in different ways through Kinship Caregivers Connect. And I also work with a program called Kin Carolina in North and South Carolina. So it's just such an honor to be able to get to know those families and hear their stories. And honestly, they're the people that keep me going and keep me grounded in the work that I do. But when I was choosing my capstone project while I was a student at Ohio State, I really wanted to do something more on the system level, because if the systems aren't there as a support and working together, it's really hard for kinship families to access the supports and services that they need. And I had a little bit experience doing field work as an OT in the schools. And I was just like, I feel like the schools is the missing piece. A lot of times, I feel like it's a system that isn't thought of. Like we think of child welfare, we think of the legal system, but really every family is connected to the school system. And especially families who are informal, who may not have open cases with child welfare or become licensed as foster parents, that can sometimes be their only support. So I really was excited to partner with the Ohio Statewide Family Engagement Center, and we will be sharing a link to their website as well, specifically Dr. Barbara Boone, to put together a training titled Partnering with Kinship Families in Schools. And it was a really great experience. It was actually during COVID time, so it was completely virtual. And I think definitely like in person and online, there are some pros and cons to both, but we were able to design it to get in front of like over 400 school professionals over that semester, which was really exciting. And partnering with a statewide network was very helpful, trying to offer different times and also making it as interactive as possible. Something that we really wanted to prioritize in putting together the training was making it interactive and making it reflective. Exactly what you're saying, Lori, going from the intellectual to like, okay, I really understand and care about the issue. And we actually collected feedback from the school professionals we were working with to see what was most impactful to them. And they said it was the caregiver stories that really helped them to understand kinship care on a deeper level. So we had short videos that we included throughout the presentation of different caregiver stories. So it's not just one family they're seeing some different perspectives, but really hearing from caregivers themselves. And it's those things that you don't really understand, like, grandma's picking up, Billy from school and she seems like really stressed and busy, but they may not understand why grandma's stressed or busy. They might not understand she's just had to go to court and fight for her legal rights. They might not understand like she's not able to get the financial supports in order to have those things in place or enroll in a free lunch program, or even like grieving that loss of being a grandparent and now stepping into that parent role. So I feel like there's so many things underneath kinship care that are important to highlight, and those caregiver stories were really able to bring those out. And then after each story, we also had a chance for a reflection so they can really bring it to their own experience. And we also provided a lot of general information as well. So defining kinship care and also speaking to the strengths of kinship care givers, and also why kinship care is important for kids as well. Everyone in schools hopefully is interested in like child well-being and their academic outcomes, and we do know that kinship care supports that. So in showing the strengths, you can really get buy-in per se of the school professionals and others there, because they see like the importance of supporting those families so kids can stay with kinship caregivers. So those were some of the things that was helpful. And actually a big point of feedback that we got, we compared the differences of like foster care and informal kinship care, so unlicensed kinship families. And in Ohio, there's a really, really big presence of informal or unlicensed kinship families. So we showed some of those statistics and literally had like a chart comparing foster care versus informal kinship care. And that seemed to really like open the eyes of educators and professionals. And they also had the idea of what foster care was, so it could be kind of a comparison group. But we also showed a chart that Generations United put together a long time ago, I think like 2011, but it compared the TANF payments of informal caregivers to the payments that foster parents get. And that was also very eye-opening. So it seemed that educators weren't really aware like the differences in resources that kinship caregivers were getting compared to foster parents. And that was part of their like interest in wanting to support this population as well. So those are some things that were helpful. Online, we did do breakout rooms, and I have done trainings in person as well, and even just doing like partner discussions. So there's time to reflect. And I think it's anytime someone can take the information and then apply it to their own experiences. And then the second half of the training really focused on, okay, we know this information about kinship care. How can we use it in the schools? And really providing some clear pathways and even concrete tools that are ready to implement. So we have like the school checklist form. I also created a worksheet that was getting to know your kinship family. So it's some questions that you can ask the kinship family if they're new to your classroom or you just became aware there's a kinship situation, so you can learn how to best support them. And we also tried to share resources. So there's a kinship navigator program in Ohio, Ohio Can. I did see an Ohio Can person on here earlier. So, if a family's struggling, you can refer them to this program. So really thinking about from a school professional or educator standpoint, how can we help them help the families too? And even talking about, of course, like the mental health and trauma informed side of working with all families, but why especially that trauma informed approach is important for kinship families. And using inclusive language when you're talking with caregivers. We had like a slide about like trauma informed strategies when communicating with them, and also like things to look out for children in kinship care because they may have higher needs than their peers. So there's a lot of information we fit into an hour and a half. I feel like that's the hardest part, deciding what to include, but it seemed like those key takeaways were the most helpful, partnered with like the discussion and then also the caregiver stories as well. And something that helped was we actually adapted the training to different time frames. So we had like a 20-minute version, 45-minute, hour and a half, so you can really meet the needs of the schools. And I was able to adapt this training to present to OTs for one of their professional developments. So I was able to like add in some OT specific things. So I think it's kind of having that core and then adapting it to the specific audience. And I know Generations United has a free training that they have ready to implement. So even thinking about if you'd like to start with a training like that and adapt it to the community you're presenting to. But just thinking about like, what are the ways I can make it easiest for the schools, knowing, as Lori said, they have so many like priorities and different things that they have to put their attention towards. So how can we make it the easiest? And also how can we show them why supporting kinship families is so important? So thinking about if you can get in on those like professional development days, or if you have funding for it, like providing lunch and doing a lunch and learn, and even coming to the school and say like, I have this free training I can offer you. I think if you're able to do things for free, that always helps, of course, as well.
Yes.
So those are some of the things that have helped along the way. And I think partnership is just like the biggest takeaway. How can we all come together and not only like get the names of our organizations out there, but truly be a support to schools. And if they have questions, like always keeping that open door line of communication to, keep those partnerships and just really all be together and advocates for kinship care. And hopefully like they might not know the term, but they definitely know the family. So really drawing in on that expertise that they had. And we even started off with like true or false questions to see what everyone knew. And the school professionals knew like a lot already. So it's kind of just bringing context and showing the layers underneath kinship care that people may not understand in terms of the strengths, but also some of the challenges as well. So sorry,
Thank you
that's
so
about
much, Angela. Thank you. Yeah, and we have a lot of, I've been seeing the chat a little bit and know that, we at the network have a lot of free resources, including, a list of all the Kinship Navigator programs around the country, grand facts for each state, and all of that is linked in the toolkit. And a lot of what Angela and Lori have talked about, because both of them informed the toolkit. So there's a real richness of information in that document. And appreciate you two sharing your wisdom and your life experiences and everything with us so much today. We will move to the second panel. And as I say, save your questions for Angela and Lori too for the last 30 minutes. But we're now going to talk about special education and how it impacts kinship families uniquely. And we have Emily Peeler, we have Victoria Gray, and we have Rainey Jutsi, all of whom have firsthand and professional experience with these issues. So I will start with you, Emily, and I would just wonder if you will speak to, and I don't particularly love this phrase, but basically the legal rights that kinship caregivers have to participate in the development of IEPs and 504s.
Yeah, absolutely. So, hi, everybody. As Anna said earlier, my name is Emily Peeler with the ABA Center on Children and the Law as part of our kinship team and our legal center for foster care and education. So, I'm especially passionate about these two areas overlapping. But the bottom line is, like Anna highlighted and like the toolkits highlight, is that a kin caregiver, even if they don't have any sort of legal relationship with the child, still has a right to be a part of that IEP process or 504 planning, right? Um, Anna had on a slide earlier the exact language in IDA. IDA is the special education law, federal special education law, so every school district is following it. That outlines what exactly a parent means. And number 4 in there is an individual acting in place of a biological or adoptive parent, including, and they specifically mention grandparents, step parents, or other relatives who the child lives with or is who's legally responsible for the child's welfare. So I think a lot of the kin caregivers we're talking about here, whether or not they have that legal relationship, will fall under that part of the law. Now, I will say there's an asterisk on there that says that if a parent, if that biological parent is attempting to act and they're trying to do so in the best interest of the child, they're going to be able to do that. They're going to be presumed the parent. So if that parent is trying to act in the IEP process, it would kind of overrule that ability of a kin caregiver to be that parent. But that doesn't mean that a kin caregiver still couldn't come to IEP meetings, still couldn't support the special education advocacy of that child. Generally, the parent is the one who's setting the attendance at that meeting. So if the kin caregiver does have a good relationship with a parent, they could ask for an invitation there. I will also say that part of those rights mean that they not only get to go to those IEP meetings, they can request evaluations, they can advocate throughout the year, but really they should be the ones, if they're considered the parent under IDA, to sign that IEP, right? And that's the legally binding document that says these are the services that child is going to receive, and what they should follow up on throughout the school year to make sure that the child's actually receiving those IEP or 504 services that they're entitled to. So they should be the ones to sign the IEP if they are considered the parent. And they are also really important people to have at the table for everything. Jamal had that nice infographic at the beginning. They have a lot of information about the day-to-day things that are happening in that child's life. So they're the ones helping them with homework and making sure everything's getting done and responding to discipline and things like that. So making sure they're at the table, even if they aren't acting as the parent, is also really important there too. I also want to say that the law does say if somebody has a court order that gives them education rights, then they're automatically assumed the parent, right? So if a kin caregiver is acting as a foster parent, and they've been appointed as an education decision maker through that process, or if they have legal custody or legal guardianship of the child, the odds are that they have a legal document saying that they are able to make education decisions for that child, and that would also put them into that role. So there's a lot of different ways a kin caregiver would be at that table and making those decisions from the IDA perspective. That's about it, Anna.
Thank you so much, Emily. And the ABA Center on the Law, Emily prepared a really great resource that's linked in our toolkit about kinship caregivers and education. So I would look for that too. Thank you, Emily. Victoria, what was your experience? I know you've raised a good number of grandchildren. What was your experience through this IEP process? And do you have any tips for schools working with kin through it?
Yes. So for me, we got our first grandchild in 1992. So a lot of things weren't active at that point. The word kinship, grandfamilies, those terms didn't exist. And so we were like starting from the bottom up. One of the things was going to the school and trying to explain to them what kinship meant, who we are, what we do, and what it felt like to go to an IEP meeting. In the beginning, when I went there for my grandson, we were put off for an entire year. Oh, let's change his seat. Oh, let's move him to the back of the room. Let's move him to the front of the room. And so over that summer, I went to the website and looked up the Board of Education. And I'm like, oh, they're not doing any of this. So when the doors opened and school started again, they were like, well, we were thinking maybe we could try. And I had printed out the paperwork, I had highlighted it, and I said, why don't we try this, which is printed on your website? And then that year, he got the services he needed. But a lot of things that happen is the biggest thing for me, and this is why my nonprofit helps a lot of the families going to school, is that at that meeting, you feel like you have no say. You feel like you're there just as a token to sign a paper because the psychologist is there, the nurse is there, the behavior, all of these staff are there. And so I've heard from a lot of families that said, well, I figured they knew what they were talking about. No, you are the guardian for that child, whether it's kinship or foster care or whatever. But as kinship, we don't have the knowledge that's needed. So we come to this meeting and they're using acronyms, IEP. We're like, what is IEP? What's of this? What's of that? And we just say, well, they must know, and we accept what they say. But a lot of the families are just not participating because they feel like they're not being heard. They don't understand what they're saying, and they don't have the information they need to move forward. So it's very important. I was very lucky to get into a school district, and I think Mr. Robert's slide was in there, and he and I met. He didn't understand kinship, so he and I worked a lot on that, and it was just amazing at how the schools then began to open up and like, oh, we need to do this. We need to change the language. One of the things that I suggest is that when they're talking to the family, ask them, do you understand what I'm saying? And, they were like, well, most of them were saying no. I said, right, because you never asked them that. They just listened to what you had to say, and then you said, sign here. So a lot has changed over the years. We had 7 grandchildren that we were in kinship with. And so we became really good friends with the school. Like Laura said, the principal, the secretary, the school counselor. But, every family don't get that opportunity to go in and introduce what kinship means in an environment where they're really listening, where they're really hearing what you're saying, and are willing to adapt to make sure that you are welcome in that environment and that the children are getting what they need. So it takes sometimes a little while, but the programs that are out there now are so much better. And I'm always willing and able to go to the school with a lot of the kinship caregivers, grandmothers and things like that, grandparents, great grandparents who don't even understand IEP at any level. I even had a grandfather that I was working with who was illiterate. And he sat through the meetings just going, They said, sign here. And he signed. I said, no. So when I went with him, I said, do you understand what they're saying? And he said, no. And I would make them break it down. And they were a little upset about this. But if the caregiver doesn't understand, they can't help. The school was just passing this particular grandfather on, getting him through the meeting and stuff. But in the reality, once he really understood, he was able to help his grandson also because he understood what it meant. And so we just need to, Angela's doing such a great job, educating the families, educating the principals, it's just amazing now from 1992 to today. They've come a long way. We're not quite there yet, but if we can start recognizing grandfamilies, where they are, kinship caregivers, what they understand, what they don't understand. And the biggest thing, I'm going to say this, is getting them past the guilt. A lot of grandparents are like feeling ashamed because their child did not do what they were supposed to do. And they feel like, they're going to say, oh, you have to raise your grandchild. Why, what did you do to your child? That kind of thing.
That's a common feeling.
I hear that a lot. And so we
yeah.
just need to get past that.
Well, thank you so much, Victoria. And we'll have more of an opportunity to talk in the next 30 minutes. Rainey, you work, I know, because I visited your program, primarily with Ken who are raising children with special needs. How do you, as a nonprofit, help them through that process? And what do you think other nonprofits around the country can do to better support the families?
Yes, thank you. So ISDD, or Innovative Solutions for Disadvantage and Disability, long name that doesn't say what we do. So what our focus, and the only thing we do, is support kinship families. So we're the largest comprehensive provider of kinship support services in the Atlanta metro area. And our special focus is on those families that include children with special needs, because we recognize that just makes the whole job even more difficult. And it's very prevalent in families, unfortunately. So, assistance with IEPs and 504 advocacy, that is one of the most common requested service that the families have. And Victoria did a great job of outlining the why of that, because, it's a very complicated process. It's filled with acronyms and jargon, and caregivers go into a room filled with, these educators and experts who often think that the caregiver understands the process, but they don't. And we've also found, on the other hand, to be fair, that sometimes schools don't understand the process, because more than once we've had a caregiver come to us and say, well, my child's school said they don't do IEPs. Well, yeah, you do. If you're taking federal funding, yeah, you do. So it's an education process sometimes we have to have with the school, as well as the educators. As the grandparents or caregivers. Our goal is to enable the caregivers to be strong advocates, but we're there for them. Our case managers are specially trained in special education law. There's a wonderful resource on the web called Rights Law. They have lots of information and materials, lots of training programs, webinars, in-person trainings. And we just went ahead as an agency, and I invested in a set of the training videos and manuals, so that I have the ability to make sure that all the staff can be trained. And I would definitely recommend other kinship organizations look at that, because it's, like I said, it's pretty a very common request. And the rights law materials are also, they're easy to understand. They're written not just for professionals, but also for parents. So I think that's it in a nutshell.
Well, thank you, Rainey. And I know we'll have another opportunity. I'll ask the team to drop in the chat the Zoom meeting link, because we will all get off of this webinar in about 3 minutes and go over to that, if you're able, that Zoom meeting link to talk more with the panelists and ask your questions. And you can get off mute and turn on your camera and ask away, or stay on off camera, but you can ask away. I dropped in the chat, Rainey's program is a kinship exemplary program that's been designated by the network, and we visited it and we wrote up their practices, so you can learn more details about her program. And I dropped that link in the chat. And then I believe we're asking for you to complete a short survey, if you're willing, about this webinar, so we can learn and develop future webinars that meet your needs. We have 2 coming up in February, as I mentioned, which you can access through our website and register for that. Has the Zoom meeting link been dropped? I don't see it yet. Do I? Anyway, if you all will drop that team, drop the Zoom meeting link into that, so that we don't lose our folks for our Q&A. And know that we are available here at the Technical Assistance Center for any questions, individual assistance you need. Emily's one of our subject matter experts. We can punt the question to her. We also have 2 technical assistance specialists on staff, Shayla Bottoms and Kylie Craggett, who are on this webinar today to help you with any of the tips in the toolkit and anything else you need. So with that, I think you will get the slides, you will get the recording to this. We hope that you join us for the Q&A session at the Zoom meeting link that was just dropped in the chat. So you don't have this. You'll have to get off this and get onto that. Because that gives us the ability to get off camera and to talk to each other, without just chatting. So I hope to see you all on the other side of that. We will keep this open for a minute so that you're able to click on that link and join us over there. I hope everyone sees it. And thank you so much for joining us today.